Hello, everyone. Welcome to Conversations with Sekani, a podcast for people in their 20s who are trying to figure out life and not get lost along the way. Today's guest is Natalie Rubenstein, co-owner and licensed insurance agent at West Medicare Advisor. Before entering the insurance industry, Natalie worked in education, a background that still shapes the way she serves people today. Rather than simply selling insurance, she believes in educating individuals so they can make informed decisions about one of the most important aspects of their life, which is their health. Alongside helping people navigate the often confusing world of Medicare and financial planning, Natalie is passionate about community involvement and supporting fellow women entrepreneurs. Natalie, welcome to Conversations with Sekani. It's a pleasure to have you on.
Yes, thank you for having me.
All right. Okay, so Natalie, I want us to start with your story, right? So, what were your 20s like, and what did you imagine your career would look like back then?
Well, I didn't think I would be an insurance agent, that's for sure. Um, in my 20s, I was definitely still figuring things out. I would had a background in education, and then I um, started working in sales, and so I just kind of figured I would do that for, you know, the remainder of my working career. And then, I made a big leap to join my husband in the company that he had started in 2020.
Wow. Oh, all right. So you also, you began your career in education before transitioning into insurance. So what
Hmm.
inspired that career change?
Yeah, so I think that I had a background in education, and then I went into sales and probably spent the most of my time there. And sales was really lucrative for me, but it became increasingly hard to have a work-life balance that I needed. So I wasn't able to give everything I had to my 8 to 5 job where I was, doing different types of sales. And so my husband started our company, Midwest Medicare Advisors, in 2020, and it was getting to the point where he needed to hire someone because he was growing at a faster pace than he could handle by himself. So we decided the best thing for, the business and our family would be for me to leave my, corporate office job and come work with him. And I use education every day. So Medicare is, very confusing. And so every day I feel like I'm using what I learned in my education to help individuals understand their Medicare coverage.
Mm, all right. Thank you, Natalie, for sharing your story with us. Actually, I do appreciate that. And yes, I want us to dive into your work now.
Hmm.
Medicare is something that many young people don't think about, right? Yet it affects nearly every family eventually. So why is it so important for people to start understanding healthcare, planning rather than, just later, right? Why do you think it's important for them to understand it early?
Yeah, so the financial implications, I think, are the most important. So, for people
Mhm.
who are planning for retirement financially, they need to understand the costs of Medicare so that they can plan and so that they have, good coverage because typically when people are coming onto Medicare, they're at an age where, you know, they might be healthy, but at any instance, their health can decline. And so being ready for every situation and being able to pay for whatever you need, in regards to the best care for yourself.
Mm. All right. Wow. Okay. So another thing you say is that your goal is to remove confusion through education,
Yeah,
right? So why do you think education is such a powerful tool when making financial and healthcare decisions?
because, well, I think a lot of times your health and, when you hear, when you get to the point of Medicare, there's usually a lot of things going on in your life, right? So either you're turning 65 or you're retiring from your job, and a lot of times it can be really easy to just feel overwhelmed by Medicare and by all the different choices that you have to make. And so you can end up just saying, you know what, I don't want to deal with this. You answer the first piece of mail that you get, or just sign up for a plan that your sister or your neighbor has, instead of actually looking into what's going to be best for your financial well-being and your health well-being as well. Um, and so taking the time to understand how it works is going to be important so that you can make the best decisions for yourself.
Mhm. All right. So thank you for that one, actually. And every week you share Medicare Monday, right? You
Hmm.
use real customer experiences. So what have those conversations taught you about, the questions people are often too afraid to ask?
Yeah, I think that most people who are transitioning to Medicare, they don't know anything about Medicare, or they are assuming that they know something that's incorrect. So, for example, one misconception is that Medicare is free. So a lot of people who are, transitioning to Medicare, sometimes they have sticker shock by the cost. And
Mm,
so that's kind of the number one thing that we discuss, because yes, while you have it deducted from your paychecks and, every week or biweekly, it doesn't necessarily mean that you're going to get your health care for free, right? You get a portion of it premium free, but there's still a lot of costs that are associated with it. Part B, you'll still have premiums for that. You'll still have to pay out of pocket for a supplement, or out of pocket for any co-payments or co-insurance with Medicare Advantage. So that's probably like the biggest um, misconception that we've uncovered during our Medicare Monday. I think also, the topics have been really um, timely, because so much changes with Medicare that we're able to easily educate our clients through Medicare Monday. The
mm, wow.
GLP-1 program that was just released, so we were able to do one, discussing who's actually going to be able to take advantage of the program and what it actually
Mm,
covers.
mm, wow. All right. So I actually do highly recommend the program, right? Medicare Monday, where people can get to learn a whole lot about, healthcare and
Yeah.
everything, basically.
Yeah,
So, yeah.
the other thing too is that everyone's situation is different, and that's why I like
Mm,
using real life examples of things that we encounter, because someone else is bound to run into that or have that question. Maybe they haven't thought about it yet.
mm. Oh, all right, thank you for that one, actually. And yeah, I'm gonna towards the end, I would, ask where people can get to, reach out to you in case they have any questions whatsoever. Right.
Hmm.
So, and Another thing is that you've worked alongside your husband in building your business. So what have you learned about, balancing marriage and entrepreneurship?
Mhm. Um, a lot. I think that when we first decided to work together, we obviously didn't know how it was going to work, but we have a pretty solid marriage. So we thought that, this would translate well. And it has. I mean, I think we both know what each other's strengths and weaknesses are. And lucky for us, they're kind of the opposite. So we're able to pick up where the other one um, might need some help. The other thing is that, it gives us a common goal that we're working towards. So building our business, making sure that we have, um, you know, generational wealth for our family and our kids, is a goal that, we're both working towards as, we grow the company.
Mm. Right. So yes, my podcast, right, is for young
Hmm.
adults, right? So I just trying to figure out life and also make sure that they make good decisions, right, while navigating life. So, financial planning often feels like something that people can postpone. So why do you
Hmm.
think developing good financial habits in your 20s, makes such a difference later in life?
Yeah, I mean, I think it's so important because the sooner you start, the more, you know, wealth you'll accumulate later on. But the biggest thing that everyone should be doing is contributing to a 401k, especially if their employers are offering a match. And so, I mean, that was something that I learned really early on. And when I started my career, and I was able to, build up a lot working with other employers who were doing a match and convert that into an IRA that I now just contribute to normally.
Mm. Wow. All right. So what do you think are some of like the good financial habits we should start, developing now, right? In order to just, be better later.
Yeah, so definitely contributing to a 401k and saving for retirement and also just a rainy day fund, right? So that's
Mm.
something is always going to happen. A nail in your tire that needs to be replaced, or your washing machine breaks, so you never want to feel like you're you don't have enough saved to pay off those expenses.
All right. So like you said, contributing to 401k, saving for rainy days, and also saving for retirement. Right. Okay. So thank you for that one actually. And yes, finally, right. If you could just speak to someone out there, right? Specifically younger adults, right? What
Hmm.
lesson would you want them to take away from the conversation we just had today?
Yeah, I think that if you are in a career transition, don't feel like you're stuck. You always have to do what's best for you and your work-life balance. And so if you aren't happy where you're at, find the courage to find something that you do want to do and that's going to make you happy, because we spend about, we spend a lot of time at work. And so making sure that it's something that you enjoy doing and something that, you feel happy with is important.
Mm. Right. Wow. Oh, thank you, Natalie, for that beautiful one. Actually, and it moves me to the final segment of my podcast. I call it the rapid fire segment, right? You could either answer with a word or a phrase starting now.
Okay.
So Right. Do you prefer coffee or tea?
Coffee.
Hmm. Okay. So are you a morning person or a night owl?
I used to be a night owl and now I'm a morning person.
Okay. All right. So what is one book you'd recommend to any young adult?
Oh, The Five People You Meet in Heaven.
Hmm.
I can't remember
But
who the
the
author
name of
is.
the author?
Yeah, let me look it up.
All right. I'll have to. Okay.
Oh yeah, Mitch Albom.
Mitch Albon. All right. Thank you for that one, actually. And yes, what is a habit that has made the biggest difference in your life?
Hmm. Working out.
Hmm. Wow. Working out. Okay. All right. And then finally, what does success mean to you today?
It means that I can provide for my family and that they can, um, see their mom and dad working together and creating something for them
Mm,
if they want to join, when they get older or, have the courage to start their own business.
mm. All right. Well, cool. Okay. So yes, thank you, Natalie. And before you go, where can listeners get to, learn more about you and also connect with you?
Sure. So we have our website, which is www.midwestmedicareadvisors.com. And then we have a LinkedIn page with our title as well, and then Facebook as well.
Oh my God. So I'm gonna put the link in the show notes so it's easily accessible for listeners, right? And to
Thank you.
my listeners, I want to say thanks for tuning in to Conversations with Sekani. If this episode sparked something in you, just as it did in me, make sure to share to someone who you think might need this, and also subscribe so you don't miss out on new episodes. Once again, thank you, Natalie. Do you have a wonderful day ahead of you?
You too. Thanks so much.
You're welcome. Take care.